Everyone in this House owes a debt of gratitude to Vicky Phelan. While battling terminal cancer, Vicky took a case to the High Court. She won her case and was offered a settlement if it remained confidential, as we know. It would have been easier for her if she had acquiesced, but she refused to accept the culture of secrecy that too often accompanies scandals in Irish public life. This was not in her interest, but it was in the public interest. Vicky was concerned that if she stayed silent, nothing would change and that other women would face the same fate as her, dying of a treatable disease because of faults with the screening system. And she wasn't willing to accept that. Crucially, she felt that when things go wrong, patients and their families must be informed. They should expect openness and honesty, because if the health service doesn't recognise a problem, then how can it deal with it? We know that there has been reform of the cervical screening programme because of Vicky Phelan and the many other women who became involved in the cervical check issue. But some of the important changes that Vicky advocated for remain outstanding, and you've referred to some of those, and I want to pursue some of those in more detail. The HSE introduced a national open disclosure policy in 2013, but we all know that this does not always happen. The Patient Safety Bill is to change this. It is to make the policy of open disclosure mandatory rather than discretionary. Unfortunately, as we've been just discussing, the progress of this bill through the House has been desperately slow. While it was introduced in 2019, there has been an 8-month delay in moving from committee stage to report stage. And of course, Taoiseach, you have to bear in mind that it still needs to make its way through the Seanad. So I'm asking you if the commitment that you've just given in terms of it being completed before the end of the year will include its passage through the Seanad. Progress on another important development has also been far too slow. The state's only cervical screening lab at the Coombe Hospital is currently only screening private smears. Public screening, including screening for cervical check, stopped after the cyber attack, although private work continues in that lab. Meanwhile, 160,000 slides were sent to the United States for analysis in just the first 7 months of this year. Taoiseach, there was a commitment in the wake of the cervical check failures that analysis of these slides would be carried out in total in Ireland. 4 years later, that hasn't happened. Vicky Phelan was always adamant that action was important to her, not platitudes and not empty promises. So Taoiseach, when can we expect that the commitments made to Vicky and the other women who were victims of this failure will be delivered? Can you tell us when will mandatory disclosure be the law of the land in its entirety? And I'm talking about its passage through both houses. Secondly, when is the new National Cervical Screening Laboratory expected to be fully staffed with appropriate staff and operating? And when can we expect all cervical check slides to be processed in Ireland?
Well, again, first of all, I thank the Deputy for raising the issues, and I think I've dealt with some of these questions earlier, but I will deal with them again in terms of the specifics that you have asked. In terms of the National Cervical Screening Laboratory at the Coombe, the building is complete and was completed in October of this year. It's expected to become operational by the end of the year. A lot of that would... Sorry, I'm answering the question. A workforce plan is in place. Recruitment for the new laboratory is an ongoing priority for the HSE. It's working with the Faculty of Pathology to build the required expertise. And as I've said, Dr. Killeen de Gascoon was recently appointed as Interim Director of the NCSL. Yes, a lot will depend on the pace of recruitment. And this is high-level expertise. Now, new technologies have emerged, thankfully, in respect of cervical screening, which does reduce the capacity for human error. It's a far more significant or enhanced process now than that which pertained originally, and that's positive. And ultimately, the new laboratory is designed to become Cervical Check's main provider of cervical screening laboratory services. HSE is of a view, though, that a secondary laboratory contractor will remain necessary at all times to ensure resilience in the system. But I do believe that the route to go is to create our own national service in respect of this. And that then, combined with the HPV vaccine rollout, I think would give us a very robust approach to cervical cancer and a real opportunity to eliminate it and to reduce it very significantly in this country. In respect of the legislation, I think you will know, down through the years, there's been different debates around mandatory reporting in different areas of life, be it in child protection, for example, where many professionals believe it can be counterproductive, or at least that was the arguments advanced. I've never been of the view that the world collapses if you do certain things, and so my view is that open disclosure is imperative and that it can be a benefit to the system. And therefore the legislation is vital. I'm at the mercy of the House, or the government is too, to be fair. We do need to produce the amendments. We need to come in here at report stage and then move to the Senate. If there's agreement on the amendments, and if it satisfies all parties, then I think we can move it through both houses in a timely manner. And I think we're committed to doing that. And I'll ask the Minister to engage with his respective counterparts in relation to that particular piece of legislation. I would make a general point that the cervical screening programme has saved thousands of lives, and it's very, very important that we continue to advocate for participation in the cervical screening programme. We certainly can improve and enhance it, and I think that's what we're about.
I don't think anybody would disagree with the importance of population-based screening, and we would all indeed encourage women to participate in cervical check in particular. But, you know, we must deliver on the promises that were made when the failures in cervical check were identified. So in addition to the 2 points I've raised with you, there are 3 outstanding commitments from the Scally report that need to be actioned, including the commitment to ensure that clinicians would meet with their patients, or indeed the families of patients who are deceased, in order to discuss the failures of the system and the failure to inform them of the outcome of the review of smears. That hasn't been actioned yet. And among the 2 others, of course, one of them is in relation to data retention, and another is in relation to implications for other government departments in terms of the learnings from the Scally report. In addition to that, in December 2020, Judge Meehan issued a report on medical negligence, and that hasn't been actioned yet. So can you update us on when we're likely to see progress on each of those issues?
Yeah, well, first of all, in terms of the clinicians meeting with their patients, I mean, I'll follow through with the Minister and get a response to you in relation to where that is at the moment. That should have happened and should happen. It has happened in quite a number of cases. And in terms of implications for the government departments, I do believe that all government departments obviously will take on board lessons learned from the cervical check scandal, and that in terms of best practice, in terms of disclosure, that would follow through. And in terms of the medical negligence, that report, as my understanding, has been completed. More work is required in relation to that, but I'll come back to the Deputy with a more comprehensive response, a detailed response in respect of that issue.